Hi, everybody. My name's Joe Beggs, and I'm the project leader for Hive. I'm first going to introduce you to a clinician that we're working very closely with, Dr. Yasir Hamad.
Hi, everyone. Thank you for having me. My name is Yasir Hamad. I'm an infectious disease physician here at Washington University. And I also direct the OPAT program. OPAT, as you see, it stands for outpatient parenteral antimicrobial therapy. It simply means treating patients with IV antibiotics in their homes. Over 300,000 OPAT courses are prescribed each year in the United States, the same as the size of the breast cancer. So the way this is given is the patient usually gets a special form of an IV line called a PICC line, which is shown here as a yellow line. It goes just like a regular IV, but it goes deeper into the bigger veins closer to the heart. This allows the patients to get their antibiotics at home. On the other side of the picture here, you see a medication pump. This is a pressurized bag that has the antibiotics inside, and the patient will need to connect the end of the tubing into their PICC lines for the antibiotics to flow. To give you an example, Jack is a patient who had osteoarthritis. He had admitted to the hospital to get a knee replacement, which was unfortunately got complicated by an infection. Now Jack will need to finish 6 weeks of IV antibiotics to treat that infection. He gets discharged to his home, and Jack now has to administer antibiotics through the PICC line for an hour twice daily. It gets complicated for Jack and many patients to process this task, which leads to many patients not taking their antibiotics as prescribed, which can lead them to get back to the hospital, which is a problem we want to fix. From our data from 2017, we found that about a quarter of patients who were discharged on OPAT each year got readmitted to the hospital. And 16%, as shown in the golden color, are OPAT-related reasons. These are merely either worsening of the infection or complication from the adverse side effects of the medication, which is the antibiotics. This is an extremely expensive problem. While OPAT can cost around $250 a day, being in the hospital costs over $2,000 each day. And we know for sure from anecdotal reports and data and reports that noncompliance is a significant contributor for these readmissions. So that's why I actually approached Joe on the problems there for Sling to help us address this problem. So I asked Joe to show us what solution he developed for this problem.
Thanks.
Yeah.
Thank you very much. All right, so I'm going to walk you through pretty quickly. This is a video of our patent-pending technology. So as you can see, this is a recreation of a patient here. So you can see the IV line coming out of the arm. Our sensor is on the end of the PICC line, and all we're doing is detecting when the medication is connected. So this data, it's hard to see in the video, but it's on our piece of software here, we're showing that the medication is being administered, and when it's completed, we show how long the medication was administered for. Now, you might wonder, where is this data going? Because we're working in close partnership with Dr. Hamad and Home Health Services, the data goes straight to Home Health Services so that nurses can intervene and stop the unplanned readmissions before they even happen. So we do have some competitors. We have direct and indirect competitors. Epic is our direct competitor. And some of you may be familiar with the non-compliance field, but a lot of people are coming up with apps, and Epic is no different. They want patients to log when they take their medication. Unfortunately, if you know a thing or two about non-compliant patients, they already struggle to follow the steps that they're prescribed. So why does it make sense to add more steps to solve non-compliance? Our other competitors are crafting expensive, bulky sensors for hospital IV administration, or they're not even looking at OPAT in the first place. So we have a $4.2 billion market. This is based on 1998 numbers. There's 317,000 patients on OPAT nationally. OPAT is extremely cost-effective, $250 a day versus $2,000 a day, spread over the course of 6 to 8 weeks. So our game plan going forward, and I believe this is one of our strongest points as a business. So because we're working in such close coordination with Dr. Hamad and Home Health Services, we already have plans to launch a small-scale clinical trial once we perfect our prototype over the summer. So my team is going to stay here in St. Louis, and this is what we're doing. Once we show efficacy and safety, we will, in Home Health Services, selling the devices at $40 a pop. That alone, that $320,000, is enough to pay for our device outright without reducing any readmissions in the first place, because our device only costs $30 to produce. Once we show the efficacy and safety, we believe that insurance and the hospitals will help pay, or will pay for our device. And we can begin charging about $250 per device. So assuming, and now this is a projection, obviously this will change, but assuming a 50% market penetration, that's 150,000 patients times $250 a device, that's $38 million in revenue per year. So I'm going to tell you a little bit about my team. So last summer, I was inspired by Michael Loeb, the founder of Priceline.com, who was my mentor to get involved in entrepreneurship and really go all in. Unfortunately, he didn't know too much about healthcare, so that's where I thought I could contribute because I know about healthcare. So I'm bringing the two together in this project. Along with me, there's Chris and Glenn. They're my engineers. They are working on prototyping this summer. Sai and Ali are clinical coordinators. They're also working in Dr. Hamad's clinic and interviewing patients every single week so that we can really understand this problem. Again, in our immediate future, we have 8,000 patients that BJC Home Health Services oversees, and this is our immediate market. Thank you very much, and please, I'm happy to take any questions later.